Hello everyone. For discussion number 5 in Nursing 440, we will be talking about patient-centeredness, which is one of the 7 nursing core values. The nursing core values are what sets the foundation for all nursing practice. So the one that we're going to talk about today is patient-centeredness. The Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that the patient values guide all clinical decisions. So patient-centeredness is something that we should all strive to provide for each of our patients. I think that the way that patient-centeredness impacts my nursing is that I try to care for the patient in ways that is meaningful to them and valuable to them. The entire treatment process of your patient should be focused completely around the patient themselves. It is their care, so they have the right to decide what goes on, and they also have the right to be informed of what's going on. I think sometimes we try and skip over things or not fully explain things to our patient because we think that they might not understand, but it's important to thoroughly explain everything that's going to be happening and give them the choice to proceed with what we're doing or not. I also think that this means respecting the patient's values, preferences, and their needs. If we are not individualizing our care for each individual patient, then we are not being patient-centered nurses. I think it's important to not just get in the flow of doing the same thing for every patient, and instead of doing that, really looking at each patient's needs and how they differ from one another. I also think that it's important to provide emotional support in patient-centered care. Now, obviously, each patient is different, but a lot of patients need our support, and we kind of relieve some anxiety. I think some of the anxiety relief can be from explaining things to them and taking the time to make sure that they're comfortable with the care that they're receiving. The last thing that I think I do that expresses patient-centered care is coordination and integration of care. I like to involve patients in the decision-making that is going on with their care and recognizing that each patient will have unique wants and needs. I think if we can fully develop our plan of care as to what the patient wants, they're going to not only be more compliant, but probably have better outcomes. Thank you.